Welcome everyone to the Community Pharmacy Cheshire and Wirral monthly update for pharmacy contractors and their teams for July of 2022. These updates go on YouTube, but also on all of the major podcast platforms so the whole team can access. One thing about today's, I am going to be showcasing on the YouTube element of it some bits of the RAG service that we're launching. That doesn't stop you listening to what we've got to say on the podcast at all. It just means you might need to go and follow some of the links and have a look yourself, so it makes a bit of context later on. So there's a few things to talk about today. The first one is for the COVID-19 vaccination service. The expressions of interest do need to be submitted in by the 5 p.m. on the 20th of July. This is covering sites that wish to deliver from 100 vaccines per week upwards for September 2022 through to March of 2023. The existing contractors who are already delivering the service have been contacted separately by NHS England, and I believe at the time of publication or the time of filming, many of you, if not all of you, have already responded. There is a bit more information on these around PSNC newsletters. One thing I did want to draw out, there are some funding available to regions to allow them to use funding locally to support a continued focus on tackling health inequalities. So any contractors that are looking to offer the service, they really need to think about what additional funding would be required to provide the service in a way that would help you to meet those inequalities and to even that out. Our service is slightly different, particularly if you provide domiciliary or home care vaccinations, is that you need to have a pharmacist present, whereas other providers may not have such a clinical cost. So therefore, if you are going to put a bid in that includes those provisions, just make sure you do state your costs properly and you do say what you're going to need to be on there. If there's any difficulties, please contact us through support@cpcw.org.uk and we'll make sure that we support you through the process and to guide you through. Next topic I wanted to talk about is the Health Education England the Technician advert. I say advert, it's more about support. There's some details in our newsletter of last week, so if you're looking for that, go and have a look. But there's a really good opportunity effectively to get some funding, external funding, to be able to develop your team further and for you to put someone through the technician training course. If you are interested in this, please have a look through and apply, but it's really important that we take advantage of these opportunities as they do come. The next topic I want to talk about today is around the new medicines service, quarterly data reporting. Hot off the press, it's just been announced that it's not required for the period of April to June 2022. You don't need to make that submission. Originally in December it was advised it'd be starting up with this as the first tranche. However, it has been paused once more. We will make sure we've got the very most up-to-date information in the monthly trackers that we release to support this. However, the news this time came very, very late. I think it was the 30th of June that it came out, and it was too late for our tracker to be changed. So if there is any doubt about it, there's been an article on PSNC, it's been in our newsletter, and we will make sure the future trackers highlight in good time when that process is going to start again as soon as we know. The next contractual element that I wanted to talk to you about is the Community Pharmacy Assurance Framework, or CPAF as it's commonly known. That process is starting again, so it starts off with what's colloquially known as CPAF Lite. It's part of the screening questionnaire effectively. And that also does include any contractors that are still in the full CPAF process for this year. So please make sure you do fill it in. It is a contractual obligation. It forms part of NHS England's contract monitoring process for their assurance of quality and compliance. And the key point for me is if you do not fill in the screening questionnaire, you refuse to engage with CPAF Lite, you will absolutely be required to do the full CPAF, which is far more onerous. So it's very much worth doing. There is a really good guide for this on PSNC. I'll link it in the description below on both the podcast as well as the YouTube platform. So please have a look at it there. That questionnaire, it should open on Monday the 18th of July. It normally opens in the early hours of the morning, and then it'll be open right the way through till midnight on Wednesday the 31st of August. We'll be sure to remind you throughout the period, and we're hoping, as long as we get the data in from the Business Support Agency, We're hoping to be able to do some focused conversations where contractors haven't done it. We're going to be able to highlight individual contracts where they haven't yet done it towards the end of it, just to try and help make sure as many as possible go through. I think all the way across Cheshire and Merseyside last year there was 4 contractors that didn't take part in that, and all of those are going through the CPAF process as we speak. So it's certainly worth doing and getting on top of. It gives you a good steer and a good start to the information guide should you need to. And then the last thing I wanted to talk about today is our LPC's RAG Sheets that I mentioned last time. These are a tool that we're using that look at lots of different elements of a service specification. They're designed to allow the easy expression of the committee's view on what a service looks like, whether it's optimal, preferable, and it also is a very easy way of us expressing back to commissioners what would need to change to make it optimal and preferable as a service to deliver. Obviously all of that is a contractor's own decision on whether they want to offer a particular service or not, but hopefully this gives a bit of guidance from the LPC on that consideration of whether to offer that service. They're also quite useful for our team to use as a negotiating hook or tool. Obviously if something is not viewed as particularly well by the LPC, typically they're not very well delivered. So it's in everyone's interest to try and get a service which is manageable, it's sustainable, and it's deliverable by contractors. So the way we're going to publish them, we're going to publish them on our website. So I'll show you where it is now. So if you look on our website, what you'll need to go to from whichever page you're on, hover over your area. The one that's live at the moment is a palliative care service for Warrington. So if you clicked on Warrington under your area, and then there's a palliative care. You've got the services down the side, and there's also these other useful documents further down. When you click on the service, this may well change a little bit just to differentiate it, but what the link you're looking for is the LPC RAG sheet. And when you click on that, it'll come up. It's a PDF file, so it will load and it'll look a little bit like this. And as I say, as new services either come up for renegotiation or are proposed for implementation, this is the way we'll be doing it from now on in. So this is the launch of it, so we can show you what they look like. What this shows, it gives a little bit of positioning, the rationale of why we do the checklist. So this is to explain both to contractors, to commissioners, and to anyone else that's interested why we do it. You've got who's the commissioner and what the service is. This is obviously a Warrington service, was commissioned by Warrington CCG. It's now novated across to the integrated care system as from the 1st of July. And what we've done is we've had a look, and actually this service got rated as green. So what that means is we've got no underlying concerns. It's a service that's sustainable, it's remunerated properly, and should be considered as a positive if contractors wish to deliver it. We did have a few minor points, so the points were around the consideration and the time. This was for an extension of the existing service. It didn't quite fit in with the committee deadlines, but that's absolutely fine, and we can sort that out for next time, which we have done. And we've done some minor tweaks which we've fed back directly where the service specification and the contract didn't quite tie up, and they've since been fixed. It also tells you the timeline, so when we issue it to Commissioner, we say we're going to publish that in 10 days' time if it's an existing service, and we do work with them to say, actually, do you know what, if you come back in and change some things that would material alter this service RAG rating, then we will change and update the rating. So it's a way of working together successfully. What this looks at, this is a detailed one, so where we consulted, did we have enough time to comment on it? What was the remuneration like? Did it consider VAT properly? What was the payment structure and all the rest of it? Was it used in farm outcomes? Was it easy to operate? And it goes through and looks at several elements of that. Remuneration, training, is it sustainable? What's the length of the service for it? And crucially, what's the type of contract? And a little bit further down, how does it deal with the information governance and the data standards? Because particularly some of the companies, the big companies, they do tend to look at that a little bit differently, and they've got a lot of legal costs involved the more we deviate away from the standard contract types which everyone's familiar with. We do have a look also at how it enhances relationships with other healthcare professionals, and actually practically is it a deliverable service that would benefit both the pharmacy and the patients that access to it. We do also look about the SOPs and some other elements of it and what happens when it goes wrong with incident reportings. Has there been proper thought given right the way through? Once we go through that, there's a bit of a section where there's some miscellaneous information about what's happened, and also a suggested RAG rating, which is how we suggest to contractors to view the service. So hopefully that's a good whistle-stop tour. You will see more and more of these go live as time goes on. Like I say, the Warrington Palliative Care one is the one that's gone through. We have also, in recent committee meetings, started to look at a number of other services. So we've looked at the smoking cessation service in Cheshire East, the Sharps collection service on the Wirral, the emergency contraception in Cheshire West and Chester, and both Warrington's, the needle exchange and the supervised consumption have all been considered. They're back with the commissioners at the moment, so there might well be some changes as we go through. So they're not published at this stage, but they're within that timeline where we can publish them. So hopefully those will be useful things as we go through, and certainly it's our intention, this is how we're going to be using them as we negotiate on your behalf. That's it for this month. These briefings, for those that have seen before, we do hold them most months. We do a combination of a briefing that goes out on the YouTube and the podcast platforms, as well as we actually pilot it live at the field manager drop-in sessions that we run once a month. One decision we have made, we're going to stand them down during August. We're not sure there's going to be an awful lot to speak about then. Obviously, if that changes, we'll publish those out via the newsletter and run them as normal. And if you do need us in between, please get in contact. All our details are on the website. And if you're ever not sure, our support inbox, which is support@cpcw.org.uk, is always the best case to put anything you're not quite sure who you need to talk to. Thank you for watching, and goodbye.